First of all, thank you so much for Dr. Banshi for inviting me, and thank you for your team who organizes Super Congress, which we know with Vida what this Super Congress in past, and this is continue take this flag for the first Congress. Thank you so much. And also I want to that we little bit remind about Professor Shaukat Sadikot, who make big input in our diabetes movement, in our diabetes care for people with diabetes, especially for in low and low middle country. And we never thinking about diabetes in disaster, but suddenly it happens with Ukraine. But I start from start. I will speak a little bit more general and then go to my personal experience. Of course, as say Professor Mehab, the humanitarian crisis is very growing and represent a major global health challenge. And the political instability and conflict have resulted in record number of people being displaced from their homes, and additional natural disasters are on the rise. Health care during emergency response can understandable focus on trauma, infection, disease, and other acute condition. We understand this, but chronic disease have historically been given low priority. If you see that the WHO and United Nations make this like act now to support people with diabetes in humanitarian setting and achieve to the 2030 agenda for sustainable development. It's a lot of goals, but who will do this in practical? We will do. And if it's thinking about concrete chronic disease, diabetes in disaster, in this crisis context, the majority of people have extremely limited access to resources. The complication of diabetes are a heavy burden of individuals and their families, as well as the health systems. There are factors combined with stress and psychology challenges associated with crisis to cause additional suffering for people with diabetes. This is a rise to issue for people with diabetes. They need to better management to avoid excess patient mortality, the logistical challenges for ensuring a continuous supply of treatment, especially insulin. And if you look on one research about burden of diabetes in humanitarian crisis, that's extremely big, and this is affect population with diabetes face enormous constraints accessing care, mainly because high medical cost. If in this case, 2019 was in Harvard University was signed Boston Declaration. It set 4 major targets: unified and strengthens advocacy, universal access to insulin and other essential medicine, and diagnostic for glucemic and blood pressure control in humanitarian crisis. Establishment of unfair set of clinical and operation guidelines for the diabetes in humanitarian crisis, and improve and coordinate data and surveillance. If you look from this, from the WHO page, they make a lot of documents which can help to us to in concrete and practical situation. I will not follow for one of them because I want to more focus on practical things which I had. And there's also WHO, this is very important, maybe main things, this recommendation and how to strengthen the design and implementation of policies includes those for resilient health system and health services and in structure to treat people living with non-communicable disease and to prevent and control the risk factor in humanitarian emergency. And what they did have already, they make guidelines for insulin management for adult diabetes with people with diabetes, and this is WHO. They make this non-communicable disease in emergency. It's also a very interesting resource. And one of the new, which they make for, especially for Ukrainian for war, information for healthcare professional insulin product switch guide, switching between insulin product in disaster response set. This is very important for us because this is include a Ukrainian brand, which is now people who move to another country can be used. And also insulin storage is very important, things that ESD guidelines make this about, we know how it's storage insulin, but this is underlined, especially in crisis. But I also want to underline our IDF Europe documents, like IDF Europe awareness paper, storage of insulin, which I also co-author on this paper. This is very important because this is when storage insulin in the refrigerator at home, there is a risk of exposing into freezing temperature, which can make it less effective. This is we also must know. Go back to 24 February 2022. I never forgot when I was wake up by my friend, called me and then, Iryna, wake up. War started. It was shock. We cannot imagine this, and it's bombing, Russia bombing us. If you see on our map, it's all Ukraine was bombing from start. And this was a humanitarian crisis in result on Russia invasion. If you see, I cannot see this picture without any emotion, because this is crisis, touch everybody. Children, pregnant women, adult people. This is extremely terrible situation. This was stopped. And another case, if we speak about diabetes and diabetes care, about pharmaceutical support supplies, almost half of pharmacies do not work because of the war in Ukraine, and many medical workers and other moved to and cannot work. And from start it was panic, and many people stay 2-3 hours next to pharmacy for buy something. I say to you that I was in shock. Maybe 2 days I cannot do anything, and after this, I like wake up and start thinking that I must do something. And I decide to use my position, my knowledge, my contact, my relationship with many people all the world to help our people. And this is our action as professional. I understand that it must be based on communication, partnership, management. And there I make research how we can deliver it, because many people from different associations ask me how we can help you, how we can help people with diabetes in Ukraine. I make research that I understand that only Ministry of Health can not only get humanitarian help and also deliver it to different regions in Ukraine. Ukraine is a big country and they have a big logistic problem. And this is like communication with pharma who give to us, who have already worked and have some storage of insulin, give like humanitarian to people with diabetes. And NGO, our member association, we have 2 member association of IDF, but also another group, another association who want help, and everybody help to people with diabetes. And they're also very important for me, our communication with doctor association who help also like online consultation. And the IDF from start, we organized many meetings with our president, IDF, Professor Bolton, and our regional chair, Dr. Nitipol. was involved from start and very active in this area, and we try to do best most we can. And with our partner, Direct Relief, it's a partner of IDF. We deliver a lot of help to Ukrainian. It's not only insulin, it's also food and something else. And this is my big thanks to many partners who give to this possibility for help not only supply and also with money. And our association, one of our association, got also financial support. It's very important also. And how is about medical care in this situation? I think this is a big problem, because it's stop hospitals, stop polyclinics, stop. And but Ministry of Health organized like hotline, what you need, and also online consultation proposed. Many doctors, even not under the association, only like personal initiative. It's very also important, and this is like coordinate. Every initiative is also very important. If we speak about supplies and insulin, about, as I say, that pharmacy, many pharmacy closed, but step by step, like during 1-2 weeks, it's open, and it's that little bit better logistic, because, for example, I live in one area, and next to me was another pharmacy, and I can help them, not necessarily through the city, go to the city, to another part of Kiev. And also Ministry of Health may make one new law about how we get insulin. Before it was brand insulin, or the prescribed brand, but after this they prescribe only like short insulin and prolonged insulin or mixed, and this increase access to help. We have pharmacy have some insulin and can deliver it to people. And also many humanitarian help which we got from Direct Relief or another organization, and from Norway, as I asked, they deliver it to hospital, and then hospital deliver it to some small region. This is all very important logistic, and this is problem also. And we have many points which we must underline. This is what we must do in emergency situation, what we must put in diabetes kit in your bag. This is of course, it's a super list, but I can share my experience. I have back in corridor with insulin, with test strips, with glucometer, and with small food, and also with 1 kilogram insulin or 1 kilogram sugar. This is very important for me because I'm afraid hypoglycemia. And another case, we must remember about another health concern, that, for example, people with dialysis in many situations cannot get this. And what I can say, big thanks to another country who take these people to support, like Norway, like Sweden, who support these people who really need extremely help, and which is very expensive and maybe not possible to deliver. And also we can take care about mental health, which a lot of stress. And what I want to say that in this time, increase, I think this is only about myself, increase short insulin. In this case, dose of short insulin increase. I thought that it's only for me, but then I speak with many. I have a lot of contact and very often have communication. This is for everybody. This is because stress, and this is increased short insulin. And we also ask Direct Relief deliver short insulin more than prolonged. Refugees, many Ukrainians moved to another country, and we are very thanks to many neighbors countries, especially who give this support. And what do IDF Europe? We make from start office organized very good job and organized this complete this page, connect solidarity, which useful for practice, because very important have information which really help you, not only name of association and page and some telephone. We created some information where and with really telephone with the really person who responsible for this, and we have many feedback from people that is very good work, but in same times we try to coordinate this work because, for example, Poland is get a lot of refugees and now have not financial for this, and but grant they got relief grant, something like that. It'll improve. And terrible situation on occupation territory, which have not access to any help, any even water, how they live without light, without anything, and this is people under the us not under the us control. We cannot help them. We cannot deliver helping. And this I also asked WHO about how possible deliver this, but it's even big organization cannot deliver because Russia stopped this. And for Indian, this is I want to say that I recognize some gaps of action in Ukraine. This is health system is not ready. Many health system is not ready. In this case, we must prepare for this. Coordination is problem. Communication is problem. Control and monitoring every action is very important. It's not only sent to humanitarian help, and there's also control and mass feedback. We try to do this. I'm not sure that it's super successful, but it's very also it's not easy. And the logistic, as I say, there's some region we cannot deliver, and unavailable diabetes care. And what could be consequences? We must also ready for this, that after this is increases number of cases of diabetes because we have pandemic and we have war now, and how many complications will be increased, I'm sure. And we must be also ready for checking after the ending of war. And this is, of course, big economic burden to healthcare system. And if I participate in 2 weeks ago in Diabetes Complex Forum about this diabetes in disaster also was one of question for discussion. And I see how many organizations work in this area, but we don't know each activity. This is also very important to know. And who can we speak about WHO? That WHO must coordinate this, because WHO not only coordinate with us, they can influence on Ministry of Health, and in this case, it's really practical things. And for last, I want to share only one story, which I listened from one doctor a few days ago, that one soldier come to hospital and they was diagnosed with diabetes first one, type 1. And after the 2 weeks maximum, they got insulin, got test strips, and he go back to work. I was angry because, how is possible? He is, it's not necessary. She said, yes, I say same, but it was his choice. This case, it's amazing people who protect our country, and this is also people with diabetes. And thank you so much. Continue stand with Ukrainian. Thank you so much to all my friends in the world who help to us, who support with feeling this. Thank you so much.